We have identified in current practice, and it's all over the world, people who receive genetic testing at the post-consultation, at the post-testing consultation, they are told about their test results, what this means for their own health, and at the end of the consultation they are advised, please talk to your family members, your relatives, because they also need to get this information and get testing. And this is where the healthcare system stops, and patients are left on their own to process what genetic test results mean for their own care if they have cancer, and also to communicate this complex information to at-risk relatives. And we have to remember these are lay people. So most of the times this information is not passed on, and there is a current gap in healthcare. So what we propose is very concretely that the genetic nurse has a second post-consultation, post-testing consultation, where she coaches patients about their test results, help them cope, accept and navigate the healthcare system, what do they have to do for their own care, but also helps them communicate these test results with their family members, those who are close to them and those who they do not feel comfortable talking to them. And also the genetic nurse will follow up with those family members, facilitate their access to services, and facilitate the overall cascade genetic testing. The poster is exactly the empirical evidence we need. So we currently talk with mutation carriers, we talk with relatives, and we ask them what was about the consultation process that helped or did not help that you speak with your family members, and you tell them the message that they also need to get tested. And this is exactly the things that we identified: lack of follow-up care, discontinuation of care, different specialists, a big system, big healthcare system that the patients need to navigate, and there is nobody there to help them collect the dots, coach them how to communicate results. So this is exactly the first preliminary findings, but the themes are, what we hear is so consistent again and again. So, and it's also what we read in the literature, that we feel very confident that this is not just our small sample, it is a generalized issue.